Hi, so I wanted to talk with you about one of the therapies we offer at our center, the Purification Center, and that is the colon hydrotherapy, or also known as colonics. And some people are familiar with this, and some may not be familiar, and may also have kind of a little bit of a revulsion about the therapy. But it's really important for most people, and the reason for that is that one of the internal pathways that the body uses to eliminate toxins is through the liver. So as the blood flows through this sort of filtration system, it's a little complicated, but waste is broken down into a form which is then can be secreted or excreted from the liver. And from the liver, it goes down into primarily into a small sac called the gallbladder. And a lot of people, and even a lot of physicians, don't understand the reason for the purpose of the gallbladder, but it's primarily to metabolize or turn those toxins which are more fat soluble into more water soluble. And from there, these toxins go down from the gallbladder into a segment of the small intestine, and from there it travels through the small intestine into the large colon, and then is excreted through the stool. But a portion of these toxins can be reabsorbed through the lining of the intestine back into the body again, which is what we don't want to have happen. So colon hydrotherapy is a way to help the intestines to excrete waste or toxins more rapidly. So it might take, in some cases, let's say 18 hours to travel those toxins, to travel from the gallbladder through the small intestine, through the large intestine, until finally it's excreted. So if we can reduce that transit time down to a much shorter period, we can reduce the amount of toxins flowing from the large intestine or even small intestine back into the body. So the machine that we have is what's called a closed system, which means that attached to the instrument, the colon hydrotherapy instrument, is a disposable. In other words, every time we give a colonic irrigation or colon hydrotherapy, it's a fresh packet. The tubing, what's called the speculum, and the water hose are all fresh for every single client. So the therapist would insert what's called the speculum, which is a plastic little device that gently, when lubricated, fits up through the anus into the rectum, the first part of the intestinal tract. And then the hose, the drainage hose, is attached to that speculum, and then the water hose is attached from the machine, which has a very sophisticated filtration system. So we know the water going into the person or through the speculum into the person is extremely pure. So the person is then situated on their back on the table, the speculum is inserted, the hose for the feces to leave through the machine, and the water hose is all arranged, and then the therapist will very gently allow some of the water to go up into the colon. The person has a little bit of a sense of urgency. They'll say, "I'm ready." The therapist will open up the valve. The feces and waste will continue down that larger plastic tube and goes through like a little viewing area, which is illuminated, so the therapist can learn a lot of things about, undigested food, or sometimes, the appearance of sometimes parasites, or a stool that looks a little bit oily or greasy means that they're not assimilating their oils properly. There's many things you can view through that chamber, that glass chamber, illuminated glass chamber, as the feces passes through that viewing section. The treatment lasts for about 45 minutes to 50 minutes, somewhere in there. There's ways of helping the person to eliminate if they feel like they don't really have to go. There's certain techniques that I've taught them about how to more easily flush the feces out of the colon. If a person has a difficulty with constipation because of a lack of tone of the colon, it's called the ascending colon. It goes up the left part of the abdomen. There's a way of manipulating the temperature of the water, a little bit of cool, a little bit of warm. It helps to cause the colon to start to work once again. So colon hydrotherapy, of course, enemas have been used for many, many years. You know, one of the therapies for an acute cold or headaches or a flu, a high temperature, was actually to give a small enema to an adult or to a child to help them eliminate toxins. That was a removal of some burden on the body, so the body could recover itself from an acute situation. We also do coffee enemas, which has been around for also quite a while. That is, coffee is not during the colonic, but another time. Coffee prepared in a certain way is through a disposable enema bag. Coffee is put into the rectal area. There is a particular reflux, the hepatico, which means liver, enterohepatical reflex, which is between the rectum or cecum and also the liver. So there's an opening of the coffee. The different chemicals within coffee, natural chemicals in coffee, causes the vessels in the liver to expand, open up to clear some toxins away. It's been a great therapy for chronic pain, chronic headaches. It helps the liver to flush itself, flush its contents into the gallbladder and the large intestine. Yeah, I remember going to a clinic in Mexico, in Tijuana, where the primary therapy they used there was raw foods and colon, the coffee enemas, just to excrete toxins. They felt also that the cause of many symptoms of the people that came to visit there, from cancer, arthritis, whatever it may be, was intoxication. And the best way to get the liver purified, or toxins better able to be metabolized, was to get the liver functioning a lot better using coffee enemas. So I think that's about it. Again, we give lectures about every week or two, and that'll be one of the subjects we'll talk about. And I think that you'll find, as with most people who undergo or use the coffee enemas, it's a very relaxing, very gentle treatment. It kind of clears the mind, and it's another very, very effective therapy for purification and restoration of health and vitality. Thank you.